stem cells are unique cells with the remarkable function which they have ability to develop into many different cell types in the body during early life and growth. They serve as a repair system for the body. They're also capable of dividing and replenish other cells as long as the person or animal is still alive. When stem cells divide, it can either remain a stem cell or it will differentiate into a more specialized cell such as muscle cells, red blood cells, Stem cell transplant's definition. A stem cell transplant, also known as hematopoietic stem cell transplant or bone marrow transplant, is actually a medical procedure used to replace damaged or destroyed bone marrow with healthy stem cells. Now, what is bone marrow? Bone marrow is the spongy tissue inside bones that produces blood cells. This procedure is often used to treat certain cancers, leukemias, and lymphomas, as well as other blood or immune system disorder. Now, let's see what are the types of stem cell transplant. So, there are two types of stem cell transplant. First one, we have autologous stem cell transplant, which the patient's own stem cell or the stem cell from the patient itself are collected, stored, and then transplanted back after intensive treatment. And the second type is allogeneic stem cells transplant. This means stem cells are obtained from a donor whose tissue types are closely matches the patient. This can be from a related or unrelated donor.
There's two types of stem cell transplant, which is allogenic and autologous. What is allogenic? Allogenic is used donated stem cell. The donor and the patient must be matched. This stem cell may come from a family member or from someone you don't know. One of the examples of allogenic is thalassemia. Thalassemia is an inherited blood disorder that might affect your body's ability to produce normal hemoglobin. Next is Fanconi anemia. It's a rare inherited condition that affects your bone marrow and many other parts of your body. Next is aplastic anemia. It's a rare blood disorder. It happens when something damages your bone marrow so it can't make enough blood cells and platelets. What is autologous? Autologous stem cell transplantation use your own blood stem cell. One of the examples of autologous is multiple myeloma. It's happens when healthy plasma cells become abnormal cells. This also can affect your bone, your kidney, and your body ability to make red and white blood cells and also your platelets. Next is Hodgkin lymphoma, once known as Hodgkin disease. Hodgkin lymphoma is a group of blood cancer that affect your lymphatic system. The last one is a germ cell tumor. It's a non-cancerous or cancerous mass that forms from germ cancer. Most tumors appear in your ovaries or testicles, but they also can occur in other body parts like chest, tailbone, and also your brain.
Now we will look at the procedure for stem cell transplant. The first step is by doing tests and examinations such as medical history and physical examination, blood tests, imaging tests such as X-rays and CT scans, and bone marrow biopsy. The next step is harvesting. There are a few ways to do this. The first one that I'll be talking about is autologous transplant. Stem cells are harvested from your own body, and this usually involves mobilizing stem cells into your bloodstream using growth factors, then collecting them via. Next is allogenic transplant. This is when the stem cells are collected from a donor. The donor then undergoes a similar mobilization and apheresis process. Compatibility tests are crucial to ensure the donor cells match the recipients as closely as possible. Finally, the bone marrow harvest. Sometimes stem cells are directly extracted from the bone marrow, typically from the pelvic bone under anesthesia. The third step is conditioning. This is to prepare your body to receive the new stem cells by using chemotherapy or radiation therapy to destroy any remaining cancer cells, suppress your immune system to reduce the risk of rejecting the transplanted stem cells, and make space in the bone marrow for the new stem cells to grow. The fourth step is transplanting the stem cells. The collected stem cells are infused into your bloodstream through a central venous catheter similar to a blood transfusion. The fifth step is recovery. You will need to stay in the hospital for several weeks to allow your body to begin to recover. Apart from that, due to a weakened immune system, staying in the hospital allows you to be in a sterile environment to minimize infection risks. Finally, hospital stay provides supportive care including antibiotics, antifungals, antivirals, blood transfusions, and nutritional support. It is also important to look out for signs of recovery such as engraftment that usually occurs within 2 to 4 weeks post-transplant. The early signs usually include increased number of blood cell count.
Complication from transplant using your own stem cell. Bleeding can happen when the platelet count is very low and it will reduce the blood's ability to clot. If the red blood cell count is too low, it can lead to anemia. Infection also can happen when the virus invades into our body. Another common complication are interstitial pneumonia, where there is inflammation of the tissue that supports the lung. It can also cause liver damage and disease. Not only that, stem cell transplant can also cause complications such as dry and damaged mouth, esophagus, lungs, and also other organs. Some patients also experience cataracts, infertility, and also secondary cancer. The doctors will prescribe you antibiotics, antifungal medication, and antiviral medication to help with these complications. Complication from transplant using donor stem cells. The most frequent complication is called the graft versus host disease, GVHD, where it develops when blood cells form from the donor stem cells think that your cells are foreign and attack them. The symptoms of GVHD include rash, itching and scaly skin, hair loss, gastrointestinal symptoms such as nausea, vomiting, diarrhea, and also abdominal cramp. It can also cause liver damage where there's a yellow complexion or jaundice.